The main way in which CPT works is to look at the way people have made sense of the traumatic event. And there are some ways in which you've made sense of it that can keep you stuck in the trauma memories, and they keep occurring because you haven't really developed a story that you can live with. And that's the main way in which CPT works. And so in the spirit of figuring out the way that you made sense of it, early on there's a focus on the therapist asking more questions, hearing about the event either by virtue of the patient writing a trauma account or the therapist asking curious questions about what happened. And early on, that's the therapist's job more, and then as the therapy progresses, there are sessions that are really designed to teach the client how to become their own therapist so that they can use the skills to continue to unravel those stuck points or ways of thinking that have led to them not recovering from the traumatic event, and then to be able to apply that in their day-to-day life.
The therapist's job is not to instill our beliefs on the client. So what I more think is a better way to look at that process is the client almost going to like a court of thought in a way, where they have a prosecutor and they have a defense in their own head. And you're looking at evidence, and in your own head you're learning to look at it from multiple ways. So you take the same evidence, you write it down, they do a lot of detailed journaling, they actually write a trauma story, they write a trauma impact, and in doing those accounts, then they go back and they look at it from multiple viewpoints. The prosecutor's telling you, you're right, the world's bad, the world's dangerous, you should believe that. The defense attorney is saying, wait a minute, you forgot these nice people over here and that person at the store who helped you out when your baby was sick, and so that evidence back and forth starts to get you to have a more balanced view.